Hi, everyone. My name is Sneha Dave. I am located in Indiana in the USA, and I'm the executive director of the Health Advocacy Summit, which is a nonprofit that facilitates events and programs for young adults with chronic and rare conditions. And we are a nonprofit that's led entirely by young adults with chronic and rare conditions. I was diagnosed with a chronic condition when I was 6 years old and just graduated from college last year. And so I've navigated the majority of my life living with a chronic condition and transitioning and making the transfer from pediatric to adulthood. So just a little bit about the importance of focusing on our demographic within our age group of young adulthood. So just some facts. So young adults with chronic conditions face numerous challenges as we are entering adulthood. So we gain autonomy when managing our illness. We undergo so many somatic and mental upheavals. And then finally, we make the transition and transfer from pediatric to adult care. Just some more information. So breaks in medical follow-up, non-adherence to treatment, and unhappiness are more frequent during this period. And young people find support in peers who have lived through similar experiences and who can share strategies or tips on adapting. And so this is kind of where we as an organization have come in, and we really use peer support as a catalyst for disease acceptance during this already tumultuous time in our life. Just talking a little bit more about this field of transition medicine. So transition is a period of holistic and global change. So it might include pubertal, psychological, social, academic, or professional, and healthcare services. So when we think about transition, it's not just transitioning from one hospital to another. It's making that transition holistically. So relationships, peer support, the education system, the workplace. So kind of thinking about all aspects that influence our disease outcomes. So our organization, as mentioned, focuses on peer connection, advocacy, and access to educational information and resources as fundamental pathways to empowerment. So we, ask fundamental questions, and I'll talk a little bit more about the work that we do at Health Advocacy Summit, but we ask questions like, what medications am I on? What is the dosage? How do I refill a prescription? How should I plan for a job with stable health insurance? So some of these questions might seem apparent to you if you've lived with a chronic condition for a long time, but for a lot of us, these are questions that we start having to think about when we turn 18 or when we're independent for the first time, if that might be the case. And so these are important topics that we can't assume that ourselves and our peers automatically know, but rather these are topics that should be dealt with in the medical setting, or we should have conversations about with our family members or other people that are important in our life. So we are led entirely by young adults with chronic and rare diseases. So just a little bit of a background. So there was a 2017 study from the University of Lübeck that assessed the experiences and needs of adolescents and young adults with chronic conditions and identified the unmet needs of patients transitioning from pediatric to adult care. And so the study found that adolescents with chronic conditions often lack peer support and benefit from sharing experiences and everyday strategies with others with similar health issues. And so we were created on this need to come together for direct peer empowerment and peer support while we're learning what it means to be independent and the potential for our adulthood as well. So prior to the pandemic, we held in-person events in various states. So we started in 2017, and so we had our first event in Indianapolis, Indiana, and then we expanded to North Carolina and Texas the following year in 2018, and then we expanded to San Francisco in 2019, and then in 2020 we were supposed to be in 6 different states. And so I'll talk a little bit more about how we've adapted because of the pandemic, but also some of the core topics that we focused on in the past. So being able to advocate for yourself is a very, very important skill for our demographic because often it is us who will be attending medical appointments and managing our care on our own, rather than maybe having our family members or our parents be part of our care at all points in our life. So some of our events, when we had in-person events, they included topics of healthcare policy and legislative initiatives. So in the US in particular, a lot of health policy happens on a state-based level. So we would think about what is important policy that's happening in a particular state and how does that affect access to our care. So sort of a macro level view of advocacy. We also had topics of vocational rehabilitation and counseling. So when thinking about the transition from high school to college and college to the workplace, the accommodations that differ within each of these systems, and how to proactively know how to seek accommodations. Because I think also a huge challenge for our demographic is that a lot of us have not in the past identified as disabled, and that is very important legally oftentimes because you're able to get so many more accommodations if you classify as someone with a disability rather than someone with a chronic condition, more specifically. And that's for things like the Americans with Disabilities Act and the Rehabilitation Act of 1973 here in the US. Mental health is a huge, huge component. So anxiety and depression we've seen, and even for ourselves have experienced, has been a huge barrier to thriving into adulthood. So just accessing mental health services, knowing how to find mental health services, and just being proactive about coping with a chronic condition is very, very important. Here in the US, health insurance and financial resources can be a very, very complex challenge to have to navigate. Here in the US, it is very costly to be sick and to have a chronic condition. And so knowing how to navigate these systems and knowing where you can seek financial resources is very, very critical to learn about early on rather than later on when you're approached with these financial challenges all of a sudden. So pain management, also very big. We've had a lot of sessions in our North Carolina summit where we discussed alternative ways to manage pain. And so we had a medical professional discuss alternative therapies that we might not have thought of in the past. And just to also clarify, again, we focus on young adults with all different chronic and rare conditions because while we might have different symptoms and unique challenges with our specific diagnosis, there are some sort of universal social and emotional challenges that come with growing up with a various chronic or rare condition. We've also focused on communication strategies, prevention and wellness. And so, for example, at our South Texas event, we had a lot focused on prevention and wellness more so than in our Indiana summit or in our San Francisco summit, just because of the unique demographic needs. So we really like to focus on community and local-based efforts as much as we possibly can. And then relationships, whether that's romantic relationships, whether that's peer relationships, whether that's family relationships, relationships and identity are a huge theme of our age demographic. And so being able to navigate those can make life a lot easier, and also support with relationships is always very huge. And then recreational therapy, I think movement with a chronic illness is very important, and modified movement, whatever that may be, whether that's movement within, if you have to be in a bed all day, or movement just minimally is very important. And we try to promote that adaptive movement and adaptive therapy as much as possible. And then imposter syndrome with a chronic illness, that's often very common. I think a lot of us have experienced this idea of not feeling like we belong in a space because of our chronic condition, maybe feeling like we are not as confident as our peers because we have so many additional barriers and so many other things to think about when we are growing up with a chronic illness. And when we see our peers, maybe who are non-disabled, who are thriving, what it seems, and we are kind of stuck in this limbo, or at least we feel like we're stuck in this limbo of constantly being sick, having to navigate medical appointments, et cetera. As I mentioned, we've had to cancel all of our in-person summits. And so we have kind of focused on a variety of other tool kits. So just looking at the time. So within 2 years of our creation, we expanded to 6 different states, but now we have sort of focused on this long-term yearly connection rather than these day-long events. So since March of 2020, we had been hosting weekly virtual meetings. We now do about 6 per month. So we have 2 focused on young adults with all different chronic and rare conditions from around the world. We have 2 per month focused on undergraduate and graduate students with chronic and rare conditions. And then we have 2 focused on young adults with inflammatory bowel diseases specifically. So these have been a great way to keep that connection and to really feel supported during a pandemic where many of us have felt isolated, and particularly our demographic, many of us are high risk. So we had that even additional layer of isolation. And then so we also did an international virtual summit on August 8th of 2020. Last year, this year, we have it on August 7th and 8th. We brought together about 300 young adults from chronic and rare conditions around the world. We had 10 sessions focused on everything from entrepreneurship with a chronic illness to mental health and global health policy. So we just talked about a lot of different things that are very important to our demographic that we might not be hearing covered all the time. So that was just a great way to see how large and global our community is, because we all often don't get that interaction with our local peer groups of just meeting people who have the similar challenges that we often face. And we've also focused heavily on health equity, mostly because of our locations of our in-person summits when we were in person. So thinking about how culture can impact chronic illness, how immigration status can impact chronic illness, just so many different factors that affect our disease and affect how we cope and manage our disease as well. So thinking about that. So we have about 9 social determinants of health, focusing on everything from housing and transportation to faith and spirituality, that we're just trying to shine light on because of how much we've seen impact our care and our ability to cope with our condition. So, and then we, of course, also have done some campaigns focused on higher education. So I think higher education is a very sensitive topic within our demographic because a lot of us would love to pursue higher education, and a lot of our demographic we've heard would love to be able to pursue college degrees and beyond, but oftentimes it's inaccessible, whether that's not being able to attend classes in person or whether that's the lack of flexible accommodations. These are all factors that affect our ability to pursue education. And so we worked a lot with the American College Health Association here in the US to create resources and tools to support high-risk students during the pandemic. And we are building upon this beyond the pandemic to ensure that online education can be a component of higher education in the future, and that flexible accommodations and other accommodations can stay for our demographic, because it's very, very important for us to be able to have accommodations to be able to thrive. And we strongly do feel that given more accommodations and given the ability to have more flexible education, that we are equally as likely to be able to pursue whatever career path that we choose for ourselves. We also are very interested in civic engagement. So the ability to vote, the ability to have a say in elections, especially as young adults with chronic conditions who will be within these systems for the rest of our lives, is very important. So we did a patient voting campaign, which is very huge here in the US, to engage US voters, especially our demographic who might be voting for the first time in US elections, just to have that opportunity and to know the different options for voting, and making our voice heard in critical elections also was very important to us. So as mentioned, we are very interested in health equity. We focus on 9 core social determinants of health that impact our care holistically. And I'm almost running out of time, but I'm going to just talk a little bit about some of the partnerships we've done. We're very interested in providing the young adult perspective for chronic and rare conditions. Just not thinking about pediatric and adult care, but this in-between time, which is so critical to focus on. So we've been very excited to work with some organizations that have allowed us to bring that young adult patient perspective to the forefront. We've given a variety of presentations, and so I'm going to pass it on to Rosa, who's a young adult with EDS, so she can share a little bit more about her experiences navigating the system as a young adult. And so I'm excited that you can hear from her as well.
Thanks so much, Sneha. So I'm Rosa. I'm a patient advocate from the San Francisco area of California in the US. As Sneha mentioned, I am a young adult who has multiple chronic health conditions, including EDS. I was diagnosed with my first autoimmune condition when I was a year old, another when I was 11, and more since then. But even during periods where those conditions were more or less under control, I still continued to have a lot of confusing and debilitating symptoms that none of my doctors could figure out. So like many patients, it took years of looking for answers to finally get to an EDS diagnosis. I've likely had symptoms since I was born, but only received a formal diagnosis last October, which means that this process took almost 27 years. So I've been involved a little bit in the Health Advocacy Summit with Sneha, and she asked me to reflect a little bit about my own chronic illness experience. So I just wanted to share some thoughts and affirmations that I wish I had known during this entire journey. So without further ado, here are some of my general thoughts about navigating life as a young adult with EDS and chronic illness. First, and maybe most importantly, trust yourself and your experience. You've lived in your body your whole life, so that means you know best if something feels off. If a diagnosis or treatment doesn't sit right with you, you're allowed to keep looking. Second, listen to your body and be proactive whenever possible. You deserve to take breaks when you need them. You don't have to wait until you're in pain to take a break, so try to find ways of pacing yourself. Being proactive about your health can feel really, really difficult, especially if you've had symptoms dismissed by doctors in the past. So for any physicians here, one thing that you can do to be really supportive of your patients is reminding yourself that if someone comes to you with a concern that seems silly or small, first of all, it may not be small to them and might be impacting their daily life significantly. And second, they're likely trying to be proactive before a symptom is getting worse. One of the most disheartening and frustrating experiences as a patient is being in pain and being told by a doctor to just come back if it gets worse. Third, learn how to convey your needs both to yourself and to others. It can be really difficult to figure out what kinds of support you need, and let alone communicate those needs. This can take time, and honestly, the best tip I have for this is just talking to other patients, learning what has helped them, and finding out what kinds of support may be out there to make things feel more comfortable and doable for you. I found that when talking to physicians, it can be really helpful to convey your symptoms in a concrete way. So talking about, how they are impacting your daily life specifically. Fourth, be unapologetic about honoring your needs. Accommodations and boundaries are there to protect you and your energy when you're not feeling well. And no one has a right to pressure you into doing things that will cause you pain. So you shouldn't have to constantly push yourself past your limits. And lastly, as hard as it can be, try and get comfortable accepting help. So many of us feel guilty asking for help, even when it's offered, but it's okay to let others help you. So say yes to offers when you actually want to say yes. I want to acknowledge that even with a lifetime of experience dealing with chronic conditions, these are things that I'm still working on. I need to constantly remind myself of, because so often we get messages that tell us the opposite, that we're not trying hard enough, that we're exaggerating our symptoms, or that we should keep things to ourselves. But you deserve to feel heard. You deserve support, and you deserve to be in community with others who lift you up and understand what you're going through. Thanks so much for joining Sneha and I today. If you have questions or would like to reach out to the Health Advocacy Summit, please feel free to contact Health Advocacy Summit using the information on the slide.